Hi, I'm Kwon. Now many of you know me because I won Survivor Cook Islands, but I want to go beyond Survivor. I want to talk about living healthy lives. I'd like to share what the Affordable Care Act means to me and Asian American, Native Hawaiian, Pacific Islanders. In March 2010, President Obama signed the Affordable Care Act.
This is a defining moment for health care in this country that will provide coverage for 32 million additional Americans from all backgrounds, so they'll have care when they need it. Our patients still need Congress to stabilize Medicare and cut back on defensive medicine wasteful costs.
A health care reform will be a wonderful way for people without insurance or those with pre-existing conditions.
I'm really excited about the Patient Bill of Rights.
To me, healthcare reform means a second chance. Whether it's Filipino families who have low income, who have veterans that they're trying to take care of. It means, oftentimes LGBT folks who are often the most vulnerable in our communities. For them, it means a second chance at healthcare.
In the Southeast Asian community, there's often a lot of needs within the mental health and healthcare arena itself. This is an opportunity for their families to have access to doctors and to individuals who can help them have a better quality of life.
69% of Thais are medically indigent, and a large number of Thais are increasingly trafficked for the purpose of forced labor. The Affordable Care Act will provide health insurance to families and individuals who are vulnerable.
The Affordable Care Act offers the promise of linguistically and culturally appropriate health services, which is important because Laotian Americans are the #1 carriers of Hep B in America, and our #1 cause of death is lung disease.
Asian Americans, Native Hawaiians, and Pacific Islanders are a very diverse population representing over 50 ethnicities and 100 language groups. Limited English proficiency is a major issue among Asian Americans, Native Hawaiians, and Pacific Islanders. In fact, 32% or 1/3 are limited English proficient.
Healthcare is a human right, and everyone in this country, regardless of how well they speak English or how much money they make, they should be able to have access to healthcare in order to better our communities and in order to better this country.
Asian Americans, Native Hawaiians, and other Pacific Islanders are 16.6 million, 5% of the U.S. population.
2.4 million out of America's 16.6 million Asian American, Native Hawaiian, Pacific Islanders are uninsured.
That's higher than the national uninsurance rate of 16%.
The Korean American uninsurance rate is the highest among all Asian American, Native Hawaiian, and other Pacific Islanders. It is as high as the national uninsurance rate for Native Americans and Hispanic Americans.
Affordability, quality, and access to health and well-being are the key reasons why Asian American, Pacific Islanders, and all Americans have a vested stake in the successful implementation of the Affordable Care Act.
A lot of people think that the Affordable Care Act won't get implemented until 2014, but there are a number of provisions that go into effect immediately, 2010.
There is choice. You can continue with your coverage or choose another plan or provider.
Insured Americans won't lose their coverage if they get sick. Insured Americans will be eligible for wellness and prevention services.
I'm really excited about the implementation of the Affordable Care Act in that it focuses on wellness and it focuses on prevention.
For the first time, there will be coverage for the mind and the body.
Children won't be denied health coverage because of a pre-existing condition. Persons under 26 are eligible to receive coverage under their parents' health plan. Now, this is great news for students feeling the pinch of college tuition and student health insurance premiums, entrepreneurs and consultants, and freelancers who are between jobs or contracts.
After I graduated from college, there was a time when I did not know if I was able to have health insurance because I was no longer covered underneath my parents' plan. Thankfully, this will not happen to my brother, who will be graduating from college this fall. Thanks to the Affordable Care Act, he will be covered underneath my parents' plan.
Uninsured Americans who have a pre-existing condition will be eligible for affordable insurance through a temporary subsidized high-risk pool. This is important to me because my closest friend, Evan Chen, had leukemia, and because he had a pre-existing condition, under the old law, insurance companies could have increased his premium or denied him health coverage. It's also important to you, because if you have a pre-existing condition like hepatitis B, leukemia, or some other disease, you could have been denied coverage. But now, under the Affordable Care Act, you will be eligible for health coverage.
And I'm a recent graduate of Stanford University, and I'm also a hepatitis B carrier. And I'm really relieved that I will never be denied coverage because of my pre-existing condition.
Early retirees over 55 who work for small, mid-sized, or large firms could be eligible for temporary early retirement benefit funds.
With the recent economic downturn, many of my patients are worried that they cannot afford healthcare insurance or the COBRA that's required if they lose insurance. Now with the passage of the Affordable Care Act, they don't have to worry about access to primary health care.
Seniors and persons with disabilities who hit the Medicare prescription coverage donut hole will receive a $250 check from Medicare.
I've had non-Hodgkin's lymphoma since 1987. It wasn't until this year the Affordable Care Act came in that I received a $250 check. And I finally realized that, yes, I must have hit the donut hole. It's minimal, but I think anyone out there that has donut hole issues or cannot even afford insurance are going to be grateful.
Small businesses could be eligible for a 35% tax credit if they provide health insurance for their employees.
The majority of Korean Americans work in small businesses with fewer than 25 employees. At 49%, they have one of the lowest rates of employer-sponsored health coverage.
Over the last decade, premiums for small firms shot up 123%, while the number of firms offering coverage decreased from 65 to 59%.
This is important to all of us who are small business owners. There are 400,000 AA, NHOPI owned firms in America who employ 3 million employees.
The prohibitively high cost of health premiums has prevented many small businesses from offering health insurance to their employees. That's why it's important to apply for the small business healthcare tax credit.
Small business can be the drivers of innovation and change.
I am encouraging every eligible small business I know to apply today for the small business healthcare tax credit.
Small nonprofits could be eligible for a 25% tax credit if they provide health insurance to their employees.
This is really important because community nonprofits will have the opportunity to invest 25% savings to build community capacity.
Students interested in a career in nursing and primary care could be eligible for a National Health Service Corps, scholarships and loan forgiveness.
Native Hawaiians and other Pacific Islanders, our Samoans, Marshallese, Fijians, Micronesians are severely underrepresented in nursing and medicine and allied health professions. If you are truly committed to advancing health equity through the provision of quality, culturally and linguistic appropriate care, I encourage you to return to our community by applying for Affordable Care Act scholarships and loan forgiveness programs.
In 2011,
Federally qualified health centers will have the opportunity to double their capacity so that 20 million more patients, including millions of Asian American, Native Hawaiian, Pacific Islanders, will have the opportunity to choose them or any other facility for their access to community-based prevention and primary care.
In 2012, a new federal health disparities program will collect and report data that will enable health providers and patients to understand and solve health disparities.
Health disparities is a social justice issue. Health disparities cost this country $1.24 trillion. The provisions of the Affordable Care Act have the potential to bring about health equity and quality of life for all Americans.
In 2013,
we will see the states expand Medicaid coverage to persons 133% of the federal poverty level.
In the Tongan community, we've had a history of not having access to healthcare insurance. In the compact states, they have not been granted healthcare access, and so come 2013, we're really excited that we will be included in health reform.
There will be additional dollars to improve access to healthcare for our Micronesians and Pacific Islanders in the Pacific jurisdiction.
In 2014,
there will be no annual limits to health coverage.
No American will be discriminated against because of a pre-existing condition.
No longer will being a woman be a pre-existing condition.
Tax credits will make healthcare more affordable. Small business tax credits will increase to 50%, and nonprofit tax credits will increase to 35%.
To find out more information about the Affordable Care Act, visit healthcare.gov today.
Apply for the small business and or nonprofit healthcare tax credit.
Find information that can help you achieve health.
Find the right health plan for you.
On behalf of our participating organizations, thanks so much for all you do to advance the health and economic well-being of everyone in our community.